fallout from the pandemic drove many people around the state to get coverage from MassHealth, with enrollment going up over the past year by 13%. The surge also highlights the program's benefits for the people covered, but also for the economy and the stability of providers, from world-class hospitals to community health centers. Some of the benefits were recently outlined by Blue Cross Blue Shield Foundation. To give us an overview is its director for the Massachusetts Medicaid Policy Institute, Katherine Howitt. Thank you very much for being with us, Katherine.
Thanks for having me, Chris.
Katherine, that jump in enrollment sounds impressive. It meant people were able to do maybe something like what they were able to do before. But what if they had not been able to do that? I mean, what would have been the consequences?
Yeah, I think that's a really important question, and I appreciate you starting us off on this. I think the pandemic really exposed a lot of fault lines in our public health system and in our healthcare system. But one thing I think it really underscored was one of the key takeaways in the issue brief series that we're here to talk about today, which is that MassHealth plays a really important role as a safety net for people whose physical, economic, or mental health gets impacted by circumstances beyond their control, like a pandemic. So as you said, Chris, enrollment in the program grew by over 13% between March of 2020, when Governor Baker declared a state of emergency about COVID-19, and January of 2021. But that's over the same period when we know that so many people were losing their jobs, and with their jobs, their incomes, and their, in many cases, employer-sponsored insurance. And so it's clear that MassHealth played a really important role in sustaining access to healthcare coverage, as well as to needed health services throughout this pandemic.
Well, I know flagship hospitals got a lot of money from this. Maybe they can always get a lot of money from their own fundraising. But what about community health centers? Because I think they even derive an even larger percentage of their money from MassHealth, and they've been through a rough patch putting off appointments with people during the pandemic. How important was it for them?
Yeah, I mean, I think MassHealth, both through the pandemic, but also just generally, plays a really important role in providing a critical source of revenue to healthcare providers throughout the Commonwealth. So as you highlighted, a large portion of community health centers revenue comes from MassHealth. That's really always been the case in the Commonwealth. But what many people don't realize is more than half of nursing home revenue comes from MassHealth. Over a third of revenue for prenatal care providers comes from MassHealth. And as you said, about a fifth of revenue for hospitals comes from MassHealth. So MassHealth is really a very critical source of revenue that supports healthcare providers across the spectrum in the Commonwealth.
When people don't have coverage at all, even from MassHealth, they end up being taken care of through the uncompensated care pool. Explain how MassHealth enrollment helps relieve some of the pressure on that.
Yeah, MassHealth has special payments that help to reimburse hospitals for some of their uncompensated care costs. So costs where they've provided care and they weren't able to get a payment for that. So MassHealth actually pays for about 40% of uncompensated care costs here in the Commonwealth.
What about some of the other problems that were going on during the pandemic? Because aside from COVID-19 itself, it seems, and I know this is anecdotally, the thing that we heard the most about was the mental health issues and including substance use disorders. How did MassHealth help with that?
That's a really important question as well. So MassHealth has actually a really important role to play in supporting our behavioral healthcare system in the Commonwealth broadly. The behavioral healthcare system that both MassHealth members use, but also those of us who aren't enrolled in MassHealth use. So because MassHealth covers such a large portion of low-income adults in the Commonwealth, and because we know that low-income adults are at higher risk for certain behavioral health conditions, likely due to many of the stresses like lack of housing, lack of nutritional food that they have access to, that drives higher rates of behavioral health conditions in that population. And because MassHealth covers such a high portion of low-income adults, that means that it ends up covering a big portion of our behavioral health expenditures as a whole in the Commonwealth. So the most recent data we have suggests that MassHealth pays for almost half of all behavioral health expenditures in the Commonwealth. We have a lot of evidence to show that MassHealth coverage improves behavioral health outcomes, including lower rates of opioid overdose deaths, as well as other life outcomes like employment. And MassHealth actually helps to draw down federal dollars to help strengthen the behavioral healthcare system in the Commonwealth as a whole, that then benefits both MassHealth members and non-members alike. So most recently, MassHealth was a vehicle for about $115 million in state and federal dollars that helped to strengthen the behavioral health workforce in the Commonwealth, that again benefited MassHealth members as well as those of us who get our coverage through commercial insurance or otherwise.
One thing we don't hear as much about is what MassHealth does for people who are incarcerated and on the way to reentry. And I guess it seems that Massachusetts, we try to do more for them. Why is that so important?
Yeah, I think this is a really important topic, especially as we, have an increased focus on structural racism and racial inequities that are so pervasive in our society, as well as in our criminal justice system and in our healthcare system. So because of these impacts of structural racism, we know that communities of color are more likely to be incarcerated, both nationally as well as here in the Commonwealth. So, for example, Black residents account for about 7% of Massachusetts population, but 26% of the prison and jail population here in the Commonwealth. We also know that people who have been incarcerated are very vulnerable to poor health outcomes. They have significant physical and behavioral health care needs. So for example, people in the Commonwealth who have been incarcerated are 120 times more likely to die from an opioid overdose than people who have not been incarcerated. So at the foundation, we really think about, the structural racism that plays out in the criminal justice system as compounding some of the long-standing health inequities that we know exist here in the Commonwealth and across the nation as a whole. And MassHealth is actually a really important tool in helping to address some of these inequities. MassHealth has recently passed some policies to ensure that as people move from incarceration back into the community, they're enrolled immediately upon release into the community, so that there's no gap in coverage and they can immediately access the kinds of health and behavioral health services that they need for a successful, healthy and safe transition back into the community. And because Medicaid coverage can play such an important role in connecting people to the behavioral health and other services that they need for a successful transition, it's really not a surprise that nationally, at least, Medicaid coverage has been linked to lower rates of recidivism for justice-involved population. So MassHealth is just a really important tool in our fight for a more fair criminal justice system.
I want to ask you about one problem identified in the policy briefs that came out recently, and that is getting providers of mental health treatment to accept MassHealth reimbursements. What do you think the problem is there, or is there some way of getting around it?
Yeah, I think in the Commonwealth, we struggle with our behavioral, and I should say, and I think the nation as a whole, we struggle with our behavioral health workforce. And I think those challenges apply to those of us who get our coverage through commercial insurance, as well as to the MassHealth member population. I think there's a variety of different causes to that challenge, which includes challenges for people getting certified in the behavioral health professions, as well as potentially reimbursement rates for behavioral health providers. So I think there are a number of different tools at our disposal to try to address this challenge, both in MassHealth as well as in the Commonwealth more broadly. But I think it's really important to look back at some of the data that we have that really does indicate that despite these challenges, MassHealth members are MassHealth does help members get access to the behavioral health services that they need. And ultimately, we see the results of that improved access in improved behavioral health outcomes for MassHealth members.
One other thing, it's almost too big to mention or ignore. All the federal money involved here. I mean, something like half of this is paid for with federal money. Is that correct?
Yeah, so MassHealth is a joint federal state program. And what that means is that for every dollar that MassHealth spends, the federal government reimburses the state for at least 50 cents. And for some services and for some members, it's actually much more than 50 cents. So MassHealth actually generates a substantial amount of federal funding that comes into Massachusetts and it is infused into our economy. In state fiscal year 2018, I believe MassHealth generated over $8 billion in federal funding in the Commonwealth.
We should mention finally, there is an event coming up where people are going to be looking at some of this information more closely. Can you give us a little bit of a preview?
Yeah, I would love to. So we're actually celebrating our 20th anniversary at the Blue Cross Blue Shield of Massachusetts Foundation this year. So on June 30th, we will be hosting a celebration of our 20th year anniversary, as well as an opportunity to dive in a little bit more into some of the key takeaways from this issue brief series. We'll be hearing from all sorts of people who are involved in the MassHealth program, from MassHealth members to the Massachusetts Secretary for Health and Human Services, Mary Lou Sutters. The event is free. It is open to all, and people can register on our website at bluecrossmafoundation.org.
And I know you've also got all those policy briefs on your website. So if people want to look at those, what's the website they should be going to?
Yeah, it's bluecrossmafoundation.org.
Thank you very much for taking the time to join us.
Thank you so much, Chris.
Katherine Howitt from the Blue Cross Blue Shield Foundation of Massachusetts. We'll have more news in just a moment.